First of all, on Minister Catherine Byrne's behalf, I want to thank Deputy Alan Farrell, the proposer of this motion, for the valuable contribution to the debate here this evening. And I want to commend him for his work and leadership on the Oireachtas Committee. A number of important points are raised. Deputy Maureen O'Sullivan raised the issue of disadvantaged schools, also food and diet issues, the lack of childhood activity, and now the modern fear factor compared to when we were younger and children were allowed to play more freely. Now the safety issues on people's minds. Deputy Denise Mitchell raised very important issues, particularly in relation to prevention is better than cure, the issue of the junk food and fast food outlets, and also emphasised the recommendations, I think it was 14 to 18. I totally agree with that, and we cannot allow a report like this to lie on the shelf, and I take that point, and that's something that I think has to be strongly supported. Deputy Fiona Loughlin talked about it being a global problem, and also the huge crisis in the 1 to 3 year olds, where 1 to 4 year olds, 1 to 3 year olds, where 25% are overweight. That is a startling figure. So we need to deal with the nutrition issue, and also you mentioned the point about parenting classes. Deputy Anne Rabbitte rightly commended the clerk of the committee for the magnificent work in putting this report together, and also you strongly emphasised the issue of family education, public health, the issue of the vending machines, and the whole of community approach as well. So these were very, very important, Pat, and I'm looking forward to seeing your legislation as well in relation to broadcasting. And finally, Thomas Byrne was in there, and he gave his own practical experience. And I think it's important to hear people like that have made the effort and also made a contribution. So he's also talked about personal responsibility as well, and also the issue of PE facilities and issues like that. So I do take the points that we have to develop these points. And again, I want to thank everybody directly involved in this debate. I referred in my earlier speech to the STAR Communications campaign, and I want to emphasise that this is a 5-year public health awareness campaign to set families on the path to a healthier future that was launched in late 2017. The campaign is for Safe Food, the HSE and Healthy Ireland. It was developed with the input of parents, health professionals and community leaders, and acknowledges that the solutions to tackling overweight and obesity are multiple, and that every sector has a role to play in this very important health issue. Underpinned by a Healthy Weight for Ireland Obesity Policy and Action Plan 2016 to 2025, the campaign has been designed around 4 key themes to deliver a system-wide approach to tackling overweight and obesity in society. Providing families with practical advice and support to help build their confidence in making positive changes to their lives. Delivering a consistent approach across all relevant sectors, including schools, creches, hospital and GP surgeries. Supporting sustainable communities and tapping into existing community health programmes, and tackling the environment as a driver for change through key policy initiatives. Ultimately, what we do in our homes, schools and communities to help build healthy habits for all our children and families is vital to childhood obesity prevention efforts. These healthy habits are critical in helping those children who are a healthy weight now stay a healthy weight, and those who are overweight or obese to achieve a healthier weight as they grow and develop. The key healthy habits are reduce portion sizes, eat plenty of fruit and veg every day, manage treat foods not every day, replace sugary drinks with water, make being active fun every day, have less screen time, and we're all guilty of that, and encourage more sleep. I've also talked previously about the targets for overweight and obesity in the National Obesity Policy and Action Plan, and it has prescribed short-term 5-year targets as follows. A sustained downward trend, average 0.5% per annum, as measured by the Healthy Ireland survey, and the level of excess weight average across all adults. A sustained downward trend, averaging 0.5% per annum, as measured by the Childhood Obesity Surveillance Initiative called COSI, and the level of excess weight in children. And a reduction in the gap obesity levels between the highest and lowest socio-economic groups by 10% is measured by Healthy Ireland and the COSI surveys. The preparation of a progress report on the implementation of the National Obesity Plan is continued so that it can be considered by the Obesity Policy Implementation Oversight Group. Furthermore, Corla, the development of an annual bulletin or scorecard to evaluate progress in relation to the National Obesity Plan and dissemination of results has also been initiated. The position with compiling this report is that my department has requested the Health Research Board Centre for Diet and Research at University College Cork to develop a framework for this annual bulletin scorecard. This evaluation will primarily consider progress made with implementing the various actions in the national plan. The Department of Health anticipates that this framework will be finalised in this quarter. That will then allow for a quantitative, robust assessment of progress with implementing the National Obesity Policy and Action Plan to be compiled and published later this year and on an annual basis thereafter. So once again, Cancora, on behalf of Minister Byrne, I wish to commend the important and insightful work of all the members of the Joint Oireachtas Committee on Children and Youth Affairs in producing a report on tackling childhood obesity under the chair of Deputy Alan Farrell. The Department of Health was very pleased to be invited to the committee's hearings and to make a presentation on the work already underway on dealing with obesity. Finally, I'd like, Cancora, to thank the deputies tonight for their contributions on this important matter, and I'd also to reassure the House that tackling childhood obesity continues to be a priority for the Government.
Thank you very much,
you.
Minister.